Chronic back pain in the United States is an epidemic proportion, and that's the problem we have because the gross domestic product is about $14 trillion. Of that, $2 trillion is healthcare. Of that $2 trillion in healthcare, there is about $100 billion in the management of chronic back and neck pain. This is a problem, and it's getting worse. One of the difficulties is that we do so much surgery when in fact if we did good clinical screening of our patients on the front end, the chances of reducing surgery would be significantly better. The only way to know how to do things better, to your point, is measurement. If we don't measure, we really don't know what we're doing. So one of the things that is beginning to emerge in healthcare in this country is measurement, and particularly two kinds of measurement. Patient-reported outcomes, and that would be the patient reporting, for example, their pain, their function, and their quality of life. When people come to the doctor, regardless of what they come for, there are really only three things they're interested in. Is their quality of life going to be better? It might be an appendix, or it might be some other problem, maybe arthritis. So can the quality of their life be better as a result of the intervention? Secondly, are they able to do more things in their lives? And finally, can they reduce their pain if they have any? So those three areas, and patient-reported outcomes are primarily related to what the patient reports. So what's your pain, what can you do, what's your quality of life? That's been typically what we've done in healthcare and primarily in spine. Even though we haven't used the data very much, that's what we've done for outcomes. On the other hand, there are clinician-based outcomes. That is to say, what measurements does the clinician, the therapist, or the physician do when they treat the patient? Is it range of motion? Is it strength? Is it balance? Is it reduction in symptoms? Is there some surgical lesion, for example, that gets managed? So combining what the patient feels about the intervention that was done to them and what the clinician sees is a powerful way to begin to manage healthcare costs. We haven't done this very much in this country. We need to do it.